You wake up feeling a little off. Maybe it's a strange pain that wasn't there yesterday. Maybe your vision suddenly seems blurrier than usual. Maybe your heart skips just one beat, but enough to make you stop and wonder. At your age, you've learned to live with little discomforts, a sore back, a stiff knee, occasional fatigue. That's just part of growing older, right? But here's the hard truth. Not all symptoms are harmless. Some are your body's way of shouting for help. And today, I want to help you recognize which signs should never be ignored. Hi, I'm Dr. Thomas Carter. I've been practicing medicine for over 30 years. And one of the most important things I've learned is this: the earlier you catch something, the easier it is to treat. That's especially true after age 60, when our bodies change faster and recover slower. So in this video, I'm going to share 5 warning signs that mean you should see a doctor immediately. These are not everyday aches. These are red flags, and knowing them can quite literally save your life. Let's begin. 1. Sudden chest pain or tightness. Let's start with the one most people fear, and rightly so. If you feel a sudden pressure, tightness, or pain in your chest, don't wait, don't guess, don't Google. Call your doctor or even emergency services right away. Chest pain is not always a heart attack, but it's always serious. It can feel like a squeezing or crushing sensation. Pressure that radiates to your arm, neck, or jaw. Pain that worsens with activity and eases with rest. And here's something you might not know. In older adults, especially women, heart attacks can feel different. You might just feel tired, or nauseous, or short of breath. Don't try to tough it out. If something feels wrong in your chest, especially if it comes on suddenly, treat it like an emergency. If you've ever ignored chest pain and later found out it was something serious, type yes in the comments. You could help someone else take action sooner. 2. Difficulty speaking, moving, or understanding. The next sign is subtle and terrifying. Let's say you're having a conversation and suddenly your words come out slurred, or your face feels numb on one side, or you drop your coffee mug because your hand went weak. These are signs of a stroke, and time is everything. The longer a stroke goes untreated, the more brain cells die. You need to remember this acronym: FAST. F. Face drooping. A. Arm weakness. S. Speech difficulty. T. Time to call emergency help. Even if symptoms disappear after a few minutes, go to the doctor. That could have been a mini stroke, which often comes before a bigger, more damaging one. Strokes are common in people over 60, but quick action can minimize the damage. 3. Sudden confusion, dizziness, or memory loss. Everyone forgets a name once in a while. You might walk into a room and forget why. That's normal aging. But if you suddenly feel disoriented, struggle to remember where you are, can't recognize familiar faces, or feel dizzy and unsteady without explanation, that's not normal aging. That's a warning sign. It could be related to a mini stroke, dehydration, low blood sugar, or early signs of neurological problems like dementia or Alzheimer's. One of my patients came in because he got lost on a route he had driven for 20 years. That visit led to early diagnosis and years of better quality of life. If your thinking changes suddenly, or others notice you're not yourself, get checked. 4. Unexplained weight loss or fatigue. Losing a few pounds can feel like a win, especially if you didn't try. But unexplained weight loss after age 60 is not a good thing. It often points to something deeper going on. If you're eating normally or even eating more and still losing weight, It could mean cancer, thyroid issues, digestive disorders, or malabsorption, where your body isn't absorbing nutrients. Likewise, if you feel exhausted for no reason, even after good sleep, don't ignore it. You might brush it off as just getting older, but persistent fatigue could mean anemia, heart disease, depression, or chronic infections. I always say, when your body changes without your permission, that's a message, and you need to listen. 5. Blood where it shouldn't be. This last one is simple but serious. If you notice blood in your stool, in your urine, when you cough, or when you brush your teeth, see a doctor immediately. Blood in unexpected places can be caused by hemorrhoids or infections, which are treatable, but also ulcers, colon cancer, or kidney disease. Don't let fear keep you from checking. Finding the cause early is often the difference between a minor fix and a life-threatening condition. And yes, even a little blood matters. One of my patients had just a few drops in her stool and ignored it for 6 months. When she finally came in, we caught colon cancer in stage 2, early enough to treat. If she had waited another few months, we might not have been so lucky. Getting older isn't easy. You learn to live with a few more aches, a few more pills, and a little less energy. But that doesn't mean you should ignore real warning signs. Let's review the 5 symptoms that mean you should see a doctor right away. Chest pain or tightness, even if it's mild. Sudden trouble speaking, moving, or understanding. Stroke warning. Confusion, dizziness, or memory loss could signal something serious. Unexplained weight loss or constant fatigue. Your body might be struggling. Blood in stool, urine, or cough. Never normal. Always worth checking. You don't need to panic, but you do need to act. Your body is wise. It knows how to get your attention. You just need to listen. If any of these signs have ever happened to you or someone you love, type yes in the comments. You might help someone realize they're not alone. And before you go, please, like this video. Share it with someone over 60 who needs to hear this. And subscribe to Health Hub for more natural, honest health advice designed for your age and lifestyle. I'm Dr. Thomas Carter. Thank you for trusting me with your time. Stay alert, stay safe, and I'll see you in the next video.